about some osteotomy techniques to remove well-ingrown implants. It can be used for cemented implants as well. And we're going to talk about a special osteotomy technique. These are my disclosures. So after 15 years at a great spot with wonderful partners, I made a move about 6 months ago. And in that 6 months, I've gone to dinner with Charlie to cook more than I have my own wife. And I've learned a couple things about Charlie to Cook. He asks the best open-ended question possible, right? And this morning, he asked, how are you going to leave your mark on your life? And I've learned a couple of things. You don't always have to answer those questions. And here's why I don't. Because remember, defeat, for every winner, there are dozens of losers, and you're probably one of them. So just keep that in mind before you answer that question. So a couple years ago, we looked at some data on projections for revision arthroplasty volume in the United States, and we used a couple of different projection models, but it's pretty staggering to look at how many revision hips we're going to be doing by the year 2030, right? So depending on the model, it could be anywhere between 71 to 85,000 revision hip arthroplasties in the States by 2030. You know, it's humbling is to think that of all the work we've done to prevent prosthetic joint infection, our infection rate really isn't changing that much. So if you use that data and plug it into this model, that means we could be doing up to 16,000 infected revision arthroplasties by the year 2030. Pretty staggering. So that kind of mirrors my practice. Indications in my practice for removal of a well-fixed stem, hands down, infection is number one. We've done a lot of work with single and two-stage exchange arthroplasty techniques. I think number two would probably be component failure for some reason, and number three would be malposition of the femoral component.